We are back with the GMA Health Alert on kids and magnets. A new study released overnight finds the rate of kids swallowing magnets remains high and continues to rise despite rules from the Consumer Product Safety Commission on their size and strength. Our medical correspondent, Dr. Sutton, is here. Dr. Darien Sutton, let me not lose your first name there with what you need to know. Dr. Darien, so we know that dangers can be really serious. The U.S. leads the cases. Tell us about this report.
Let's just take a step back about what these cases look like, because I've witnessed them in the emergency room, and during my training in critical care, I've also seen how complicated these cases are and how deeply traumatic these stories can be. What seems to be harmless can turn out to be a medical emergency relatively quickly, and despite the safety rules, despite the warning labels, unfortunately, as you said, kids around the world are swallowing these magnets at a higher rate, and the United States is leading in the numbers. Nearly 2,000 estimated cases each and every year. And this is an example of some of these magnets. They're unassuming. You wouldn't even realize how dangerous these are. These can get lodged in the esophagus. These can get lodged in the trachea or your food pipe, your windpipe, and they can cause permanent harm. And when you swallow more than one of them, they can connect in the bowel, and that can cause a bowel rupture or perforation, which is a surgical emergency.
Okay, so as parents, we try to keep eyes on our kids, but sometimes you don't see. So if you think that your kid has swallowed a magnet, what are the symptoms we should be looking for? What should you do?
You're absolutely right, Eva. When parents come to me after a child has swallowed a magnet, it's always a similar story. You know, they were playing with it in their mouth and they got scared, or they fell, or they just didn't realize it, or they didn't know the danger. So some of the symptoms that you want to pay attention to include nausea, vomiting, abdominal pain. Those are those red flag symptoms. But to be honest with you, I think the story is the most important. Understanding and talking to the child if you can. The average age in prior studies is around 7 years old. So this is not exclusive to toddlers. All children you have to pay attention to, and if you can, explain to them the risk.
So what can you do to prevent this from happening? Any tips for parents?
And number one, survey the scene, understanding what can be dangerous and realizing that these can be in a lot of different things you might not realize. During the break, we were talking about, for example, reusable water balloons. They're really popular during the summer, and many people might not know, but they have tiny magnets in them. So you have to check not only the toys, but make sure they're not cracked or broken, because sometimes a magnet can fall out of it. A child doesn't realize, picks it up, plays with it, and then suddenly swallows it, and now we have a medical emergency. So making sure you're surveying the scene, making sure you're checking for toys to see if they're broken or cracked, and then, of course, if you can, explaining to children those risks.
That's the key, too, for parents, because oftentimes you say, oh, well, I'm not going to get magnets for my kids, but it'll be in a toy that you don't expect.
Exactly.
Something like that can cause a major problem. So, Dr. Darien, as always, we appreciate it.